located in India. I'm extremely delighted to be a part of the 7th International Congress on Child and Adolescent Psychiatry, being organized by Akasha Institute of Psychiatry, Ain Shams University. However, my presence is only virtual. So, expressive arts therapy is one of my areas of interest, and the topic of my presentation is the healing canvas, exploring the transformative power of art therapy in child psychiatry. This is an overview of my presentation. I'll start by establishing the context, discuss about art therapy and various approaches to using art, move on to the benefits of art therapy and skills of a therapist that are needed to use art, and conclude by highlighting a few take-home messages. Now, before we start discussing about art therapy, it's important to know and understand what is expressive arts therapy. Now, expressive arts include any of the following forms of therapy, which could be drama therapy, dance and movement therapy, music therapy. Art therapy here refers to visual arts such as drawings, paintings, sketching, sculpting, and so on, and writing. Now, historically, drawings and paintings have been recognized as the most useful therapeutic methods, especially in the field of mental health, when it comes to using alternative forms of art within the therapeutic context. So, expressive arts therapy, this integrates any or one or more of these forms of art therapy in a safe, non-judgmental setting to facilitate personal growth and healing. Now, what does it mean to use arts expressively? It means going into our inner realms to discover feelings and to express them. Now, this process fosters release, self-understanding, and insight, and also nurtures creativity. Now, if you look at this graph, there has been a remarkable increase in the number of research publications on the use of expressive arts in the field of child and adolescent mental health, especially in the last 1.5 decades. And as you can see, most of them are on art therapy per se, using painting and drawing, and a few on other forms. Now, this indicates that there is growing acceptance of art therapy as a legitimate form of therapeutic approach by the scientific community and professionals. So the term art therapy was first coined by British artist the term art therapy was first used in 1942, and this refers to using the creative method of art making. One needs to understand the difference between art therapy, art education, and art for recreation. Now, the common denominator of all of these three is the use of art. However, in art therapy, it is used to attain health-related goals within the context of a therapeutic relationship by a certified art or psychotherapist. Now, when it comes to art education, it is training in art to achieve artistic goals, and the training is provided often by the artist. Now, art for recreation can be used by anybody. It may include a wide range of art-related activities, and as it indicates, it's for recreational purpose. The American Art Therapy Association, it defines art therapy as an integrative mental health and human services profession that enriches the lives of individuals, families, and communities through active art making, creative process, applied psychological theory, and human experience within a psychotherapeutic relationship. So as you can see here, there is use of art to attain health-related goals within a therapeutic relationship, and that makes it art therapy. Now, how did it make its entry into the field of child and adolescent mental health? The use of art or doodling as a communication tool in child and adolescent mental health services is long established. Dale and Winnicott famously used the squiggle game to break boundaries between a patient and professional to narrate a story through a simple squiggle. Now, if you're wondering how is it different from good enough for a person test or Bender-Gestalt copying test, the primary difference is that this squiggle game is entirely unstructured, so it gives maximum latitude for a child to express their ideas and feelings, and the active participation of the professional or the therapist in this beginning makes it more fun. Now we are here at the second part of our presentation, which is approaches to using art. Now art can be used in therapy, with therapy, or as therapy. I'm going to explain these concepts to you by illustrating a few cases as we go through our presentation. Now using art in therapy refers to incorporating artistic activities into traditional therapeutic practices. In this case, art serves as a supplementary tool within the broader framework of clinical management. Techniques such as drawing, painting, or sketching can be used either as part of one's consultations or sessions or outside of sessions. Now, what does this mean? See, as part of a session, the goal can be for the purpose of assessment, psychoeducation, or to establish rapport, wherein assessing a child who is not very expressive or to assess, say, the cognitive development of a child who presents to you. This could be a bedside or the outpatient basis informal assessment that gives us a rough estimate of the cognitive ability of a child. Just as drawing test is often used in clinical practice, as you all would know, and psychoeducation of child or family members, and to establish rapport, especially with a child who is young or who is hesitant. Now, in all these three scenarios, the purpose of using art here is to navigate the skill deficit due to neurodevelopmental delay or anxiety, or assist in psychoeducation. Outside of the session, it can be used to establish a routine. For example, if one is trying to structure a day for a child with attention deficit hyperactivity disorder, or as part of behavioral activation plan for a child with depressive disorder, and also aids in sensory motor stimulation in children with neurodevelopmental delays or disorders. So in these scenarios, the purpose of art is to improve the skill deficits or the presenting complaints of low mood or poor self-esteem. Now, the case illustration is of canvas of care framework for psychoeducation. So we have developed this art-based parent-centered psychoeducation framework for the families of children and adolescents who present to our OPD and are admitted in our inpatient care. So this is an additional element to enhance routine psychoeducation. The basic premise for coming up with this psychoeducation model was that very often families of children who meet us in the outpatient department or are admitted in inpatient care come up with a repeated question of why is my child having this problem, or what is the likely course of the condition, and often have negative interaction patterns at home that either perpetuate the symptoms of the child or even lead to relapse of symptoms in some cases. So for this reason, we carried out a clinical audit to understand the needs of the families in terms of what is it that they really want to understand about the condition and the ongoing situation or problem at home, and how is it that we can come up with a model of care that can bridge these gaps. So as you can see here, we have come up with 5 images to deal or address with the 5 concepts of illness model, emotion regulation, parenting aspects of nurture and nature and goodness of it, and an overview of child mental illness, specifically on stigma. So these are the symbolic images that are used as an aid to our discussions with the families when we are educating them about the child's disorder and how they can help regulate themselves to be able to co-regulate the child when in distress, and specific parenting skills or aspects such as nurture and nature, the importance of goodness of it, and largely stigma and need for help seeking. So as you can see, the pictures are used as a tool to assess the specific purpose of psychoeducation in the larger framework of managing a given child's problem and dealing with the family. Now moving on to the second approach, which is using art with therapy. This refers to using art flexibly in the broader context of a specific primary psychotherapeutic modality. This aids in therapeutic dialogue, which could be helpful to the child to disclose or discuss their inner conflicts. As you have seen previously, the techniques are similar because we are talking about visual arts, so it could be drawing, painting, sketching, sculpting, and so on, can be part of the session or outside of the session. Art here serves as a catalyst to achieve specific targets of the therapy planned. Now, I use this case to illustrate how can art be used along with therapy. Now, 11-year-old had presented to us with an insidious onset illness, gradually progressing continuous course, characterized by low mood and irritability of 10 months duration following paternal grandmother's death. Now, this paternal grandmother was her primary caregiver or the primary attachment figure. And parents' chief concerns were spells of unresponsiveness and anger outbursts. She also had loss of interest in studies. Was often saying that she could hear her paternal grandmother and see her at times. There were demanding behaviors, anger outbursts, especially when she was criticized by her family members or when she was asked to study, followed by spells of unresponsiveness of 6 months duration. There was no significant family history. She achieved developmental milestones age appropriately, and temperamentally she was difficult and sensitive to criticism. After a detailed evaluation, we came up with this formulation that on a background and also a detailed structured assessment identified that she also had ADHD, which was not identified. Now, on a background of difficult temperament and ADHD, she had experiences of bullying at school, faced differential parenting, lack of warmth in parent-child relationship, constant comparison with her younger sibling, and negative feedback from parents, especially mother at home. And she also had cognitive distortions like jumping to conclusions. This led to the schemas of feeling that I'm bad or thinking I'm bad and unlovable. That led to the assumption of if I were a good girl, God would not have taken my grandmother away. God has punished me, I deserve to be punished. This led to intense grief and yearning, leading to dissociative spells. She was also angry, insecure, and lonely. And one of the possibilities was also that she could have self-blame and blame of grandmother's death. Now, with this formulation, we went ahead with projective testing. We were treating her attention deficit hyperactivity disorder with medicines and also working with family to address parenting issues and sibling rivalry. Now, the real breakthrough happened when she made this drawing. So, this child was not very comfortable talking or expressing what she was really going through. And she even mentioned that I would prefer writing and drawing to communicate how I feel instead of talking across the table or getting into any kind of a session. So, the breakthrough happened when she made this image, and as she discussed what she made with the therapist, she said, I killed my grandmother. So she was carrying this intense guilt, and this was arising from magical thinking, obviously, but she could not let go of this thought, which led to intense distress and dissociation and other behavioral disorders, disturbances associated with her presentation. So the individual work was focused on helping her process grief using the Strobe-Schutz's dual processing model. And we also continued to work with her parents. Initially, when she came, she had a strained relationship with her siblings and poor emotion regulation, and of course, her ADHD was not identified and not treated. So, with all these targets being identified, and once we started treating, through the also help of art, initially the picture that she made of two faces having a face off, and although this was a very symbolic representation of the sibling rivalry, and she identified it as one as well. Towards the end, as we had completed the individual work with the child and with the family, also addressed her other skill deficits. Towards the end, she made these beautiful drawings of both the sisters having a cordial relationship. And in this image, you can as well see that the sister, the younger sibling, is taking photos of her, the child performing the dance. So as you can see, in this case, we had used art along with individual therapy, which was primarily cognitive behavioral therapy we had used to help her process her grief and also restructure some of the cognitive distortions that were leading to a low mood and emotional behavioral dysregulation. So along with the primary modality of psychotherapy, we had used art which could facilitate in achieving some of the targets set by the psychotherapeutic intervention. So this becomes art with therapy. Now the third approach to using art is using art as therapy. This approach treats the process of creating art as therapeutic in itself. The focus is on the creative process rather than the finished product, as is the case with the other forms as well. The act of engaging in artistic creation is seen as inherently healing and beneficial. The two major schools of art therapy here are art psychotherapy, that is primarily based on psychodynamic principles, and person-centered expressive arts therapy, founded by Natalie Rogers, which is based on the person-centered approach of Carl Rogers and more humanistic in its application and use. So using art as therapy, I'll be using this case to illustrate how it can be done. A 14-year-old hailing from a very religious, nuclear, human socio-economic status family was brought with chief complaints of low mood, irritability, excessive crying, and loss of interest in studies of 1.5 years duration. There was family history of fantastic traits in both the parents. She achieved developmental milestones age appropriately. Temperamentally, she was anxious, self-critical, rigid, sensitive to criticism, highly conscientious, with strong moral values. Her illness was insidious in onset, gradually progressing and continuous course. She expressed death wishes and attempted self-harm in the 2 to 3 months before coming for consultation. Now, this child mentioned the cause for her sadness and distress was that she finds her assigned gender very distressing and that she wanted to change her gender to that of a male. She said that she was very confused regarding this and at times feels satisfied being a girl. She was distressed due to the uncertainty and she asked for help to get clarity for herself. This was disclosed in confidence to the therapist as she had not discussed this with her therapist. Then a detailed evaluation was carried out and we formulated it using the psychodynamic modality. So this child, as you have just seen, had a strong superego but low ego strength, and her mother was emotionally unavailable, so her attachment schema was preoccupied. This child faced adverse childhood experiences in the form of distressing experiences with opposite gender when she witnessed someone getting sexually abused or getting molested in a crowded temple. This on a background of invalidating environment due to the emotionally unavailable parents and highly critical and punitive parents led to internal conflicts such as how can I protect myself in this unsafe world where men are predators? Why is there so much gender inequality and discrimination against women? And her defense mechanisms were either identifying herself with opposite sex so she feels safer. There was also regression as she had a childlike demeanor and didn't take up age-appropriate responsibilities. The other mechanisms of defense were pseudo-altruism and reaction formation. So she aimed to help the world, help others by doing great big things. And that's how she tried to manage her internal conflicts and feel calmer. However, there was gender dysphoria because she said there is no clear thought about my gender. Sometimes it is clear or it remains strong for a few days and then it fades away. I'm confused. I feel I belong to the third gender sometimes. I identify with the male gender compared to my friends. I feel the opposite. When I go towards a girl, I feel attracted. When I go towards males, and I'm stopped. So these were some of her statements that she made during the therapy or process and during the sessions. This led to depressive feelings that I'm a bad person as I feel attracted to other girls. This is so not right. I should not be getting any romantic feelings or thoughts at all. How can I talk to my parents about it? What do? I should not live. I feel I'm the better of pet. I want to. Again, considering the taboo and stigma surrounding this specific, problem that she came up with, besides having depressive and suicidal urges and ideas, also that it was stemming from gender dysphoria and family was very religious. There was a filter that prevented her from discussing any of these issues with anyone until she came to the therapist here. Now, in this context as well, because of her hesitancy and in expressing herself, we had encouraged her to use art as a medium to explore what she was going through and then assist her in the process of therapy. So these were the images initially that she started making. Yes, I am. Be in my mind, not the face, were the titles that she had given to these pictures. Gradually, what unfolded was unbox my unbox yourself, who is a boy. So these were other images, and the breakthrough really happened when she made this picture. And the second one here, she titled it as "I want to be the male version of Radha." Now, in the Indian mythology, Radha is a female partner of Lord Krishna. So while she was making this and talking to the therapist, she explored what she was really going through and identified it as wanting to be.
الو الو احنا وقفنا بس دقيقة عشان Hi Dr. Sravanti, how are you? It's Dina. Hi, can you hear me? Hello, can you hear me? المهم تسمع بس Hi Dr. Sravanti, how are you? It's Dina. How's everything? Can you hear me? Yes, hi. We want just to test the voice to make sure that everything is fine. The audience is here and I've sent you through the WhatsApp. It's an engaging lecture.
I'm not able to hear you clearly.
Yes. How long is left in the video, in the recording?
خلينا كده يا دكتور.
I can hear someone, yeah.
طيب. Okay. طيب. Dr. Sravanti, can you wait just for 9 minutes with us?
Your voice is breaking.
The voice is breaking. Can you
But
wait?
someone who's moderating the session, I could hear them.
Yeah. Can you wait for 9 minutes for the questions?
Oh, sorry. Am I clear? Am I audible?
لا الصوت مش شغال يا جماعة. She can't hear. لا مش سامعين. Hi, you can hear me, Dr. Sravanti? Hello? Can you hear me?
The male version of Radha is not the same as wanting to be other gender, or I don't want to be Krishna here. I want to be a male version of Radha. And it's not something to do with my gender, but it's my orientation, because I am comfortable with my gender otherwise. And as she moved on to other sessions, making more art, this was what came up in subsequent sessions, where she was making, as you can see, 2 girls here, expressing love to each other. And this led to her understanding that I have a problem with my orientation and not my gender. And it was also noted that she developed transference during the sessions, because when she made an image that she called as Dreamland, where you can see this she called was herself. So she is comfortable with her gender. She imagines an outcome where she is still a girl, and she said she has set up this place to help other children who are going through difficult times. And she also added that she would like to have the guidance of therapists in her endeavor to help many other children. So the transference was also seen through her art, and this led to counter-transference in the form of distress. However, both the transference and counter-transference were resolved by discussing the boundaries And we moved on to gradually as she started to do better also, her relationship with parents had improved, her emotional regulation had improved, and her concept of herself and her identity was getting better. And other behavioral problems in the form of anger, especially in the family context, also have resolved. So during the termination phase, she had made this picture of a squirrel and narrated a small little beautiful story of a squirrel and a mountain. And her thoughts were that a mountain, although majestic, cannot move, and squirrel, although very tiny, can move about at its own wish and has control over each of its movements. And she ended up saying that, look, do not underestimate the tiny creatures or small beings, because what is really valuable in life can only be felt and cannot be seen. So, through this explanation of hers, you can really understand that she's expressing her self-esteem, which is getting corrected through the medium of art as she is interpreting the symbols and also talking about it. And on the last day of therapy, when she was asked how she felt, is when she made this picture of a mermaid that is coming out of the waters, water signifying the comfort zone, whose bright colors that are representing optimism, and rays of rainbow, which represents ray of hope, many colorful rainbows. And this suggests liberation, as she one understood what she was really going through. She also took help of the therapists and the treating team to have these discussions with her parents. And during this process, she felt liberated, and that came through in this last image of hers that she made during the therapy sessions. So as you've just seen, this process was primarily using art as a therapeutic modality in itself, wherein the child got a medium to explore her experiences and also express it with the therapist. She also addressed her low self-esteem during the process and felt more confident towards the end. Her demeanor had changed from being more childlike to age-appropriate adolescent, and her problems with the family had also resolved. One thing to make note of it here is that we were also in parallel working with the family with the help of our multidisciplinary team, which included a psychiatric social worker. And she was also in medicine for the depression, as it was quite severe when she had come. However, within a course of 4 to 6 weeks, we could achieve what we did, also with the help of art therapy. So now that we have seen different approaches to using art, we move on to the final part of the presentation, which is on benefits of art therapy and skills of a therapist. As illustrated in the previous part of the presentation, art helps in expression of emotions. It facilitates trauma processing, as it can externalize the trauma that makes it less overwhelming for the child to process it, express, and also talk about it. It enhances self-awareness, builds coping skills, can provide sensory integration, and supports neurodevelopment in children with neurodevelopmental delays and disorders. It can enhance social skills and also boost self-esteem and confidence. So the mechanisms of action could be psychodynamic, which leads to expression of the unconscious and projection of their inner conflicts in a very symbolic way. Cognitive behavioral, either as part of behavioral activation or cognitive restructuring happening during the process of art making or during discussions with the therapist. Trauma informed, which can lead to trauma processing in a very safe and contained space. Mindfulness based, as it promotes mindfulness and can help in emotion regulation. Attachment based, because this medium can also provide an opportunity for corrective emotional experiences for a child who has had attachment trauma or attachment issues. Developmental, especially as mentioned earlier, in children with neurodevelopmental delays and disorders, It provides a very good medium for sensory motor stimulation and sensory integration with the neurobiological. It also reduces the sympathetic nervous system activation, so it helps in stress reduction.